All right, hi guys, a very good evening to all of you, and welcome once again to our today's YouTube session where we'll be discussing some of the ultra important MCQs which will be relevant for our upcoming examination. Okay, so let me start this session very quickly, but I need a quick confirmation from all of you if I'm clearly audible and visible. Please give a quick confirmation. For all those who are new here, you can comment here using the live chat option. In this, there's a live chat option. You can take part in giving the responses. You can choose your answers as well. Everything is fine. Okay, all right, great. So let's get started without making any further delay to all of you. But before that, a couple of reminders about the upcoming MedMinds Ultra Combat 2.0. So one has already been done and it was highly successful. For all of you guys, once again, the 2.0 is coming on November 27. If you guys can see, it will be coming on, it is going to be held on November 27, and there will be 50 questions and 60 minutes will be allotted to all of you guys. So take part to win exciting prizes in form of iPad, laptop, multiple gadgets, stethoscope, and also in form of multiple Amazon gift vouchers as well, and multiple scholarships as well. Okay. Then FMGE All India mock test, it is going to be scheduled, I think November 13. I think it has already been conducted here. For all of you guys, NEET PG 2023 Achievers batch has been started. You can take part, and if you're buying any of the subscription, don't forget to use the code PHARMA10 to avail a 10% off in your overall subscription that you have. MBBS Prof 2 package, it's available, and just in around 4,000 you can buy a 3-month subscription. So in this you will have access to all the second prof session like pharma. Also you can gain access, patho also, and micro as well, right? So all the second year subject you will have access to this one, and for buying this one as well you can use the same code as had been mentioned, will be your pharma10. This will help you in fetching up some additional benefit in the overall subscription. Okay, so after this short introduction that we have here, let's get started. Yes, I have been just a little occupied in a lot of offline session that we have, but I hope to see you guys till examination more frequently on the online platform like YouTube. I hope to see you all guys. Okay, chalo, let's get started. And each of the questions that I'll be giving you should be a learning experience. Remember, the questions are exactly not going to be replicated in it might not get replicated, but the explanation that we are going to discuss around that will be important. Now why we are choosing this question or the explanation, because from the past 5 to 6 years we have we have been tracking the question that has been asked, and accordingly this session has been framed for all of you guys. Okay, so take good interest in each of the question about each one of the option as well, and between I'll be giving you some important summaries that should help you out. Okay, so go ahead with the very first question, and with any of this question there is something called your place image here. Please ignore this one. I think there is some error in this format of the PowerPoint, so that is I could not remove this. Please ignore this one. Okay, so let's go with the first question. Which of the following anti-tubercular drug can cause the shown laboratory profile? There is elevated TSH and decreased T3. So you can easily see there is elevated TSH and T3. The diagnosis is moving towards which thyroid condition, and which of the following anti-tubercular drug can cause? Rifampicin, pyrazinamide, ethionamide, streptomycin. Please start giving your responses already. Okay, very good. Dr. Alia has given already the response, hypothyroidism. Other students also, each one of you please take part, right? ज़्यादा से ज़्यादा गलत ही होगा, है ना? It will be a learning experience, don't worry. Great. So each one of you are telling that, okay, sir, this is possibly a case of hypothyroidism. Okay, agreed. This will be a case of hypothyroidism. Great. So correct answer is going to be ethionamide. Now anti-tubercular drug that is going to be associated, anti-tubercular drug that is causing this condition will be ethionamide. So in the ATT, we have two drugs. Hypothyroidism is going to be associated with two important drugs. One is going to be ethionamide. Do you guys know any other drug that can cause the same laboratory profile apart from this? Para-aminosalicylic acid, the first ever anti-tubercular drug that we have, it has also been shown to be associated with hypothyroidism. In addition to this, if the examiner is going to ask you which of the following anti-arrhythmic drug can cause, which of the following anti-arrhythmic drug can cause hypothyroidism? So remember hypothyroidism in the anti-arrhythmic drug, and this was one of the PYQ. Okay, in the anti-arrhythmic drug, hypothyroidism has been associated with, among anti-arrhythmic drug which is associated with hypothyroidism. So it will be associated with hypothyroidism. It can also be associated with hyperthyroidism. This is going to be your amiodarone. Remember, amiodarone is associated with your hyper or hypo both, and it is one of the class 3 anti-arrhythmic drug. Okay? Class 3 anti-arrhythmic drugs that can also cause hypothyroidism. Okay. So the case that has been asked in the past is a patient is having some problems like constipation, and also she is drowsy most of the time. That is unusual for her, and she has been recently started on an anti-arrhythmic drug. Which of the following anti-arrhythmic drug is possibly the cause? And they have given some laboratory profile which is indicating towards hypothyroid situation. Okay, so what about the other option, guys? What about the other option? Do you guys know the drugs like rifampicin that we have? What are the side effects we can see with the rifampicin? Quickly revise कर लीजिए जल्दी से. What are the side effects that we can see with the rifampicin? One is a compliance limiting side effect known as your red-orange urine discoloration. Red-orange urine discoloration. It also causes flu-like symptom. And what else does it cause? It also causes your hepatotoxicity. That is another profile, right? Hepatotoxicity. So these are the different side effects associated with rifampicin. Then we also have pyrazinamide. Pyrazinamide, it is the most hepatotoxic drug. Most hepatotoxic. And I always used to tell you 2-3 points about pyrazinamide. In the class, I used to tell you, remember pyrazinamide as pyrazinamide. Why pyrazinamide? Because among the first line drug, you have to keep the dose of pyrazinamide as the maximum, 25 mg per kg compared to all others. If you compare with the isoniazid, that is 5, pyar ka dose सबसे high. So pyar सबसे toxic भी है. It's very, very toxic. Second side effect that you should know with the pyrazinamide is it is increasing. It can even increase the uric acid level, and it can even precipitate the gout. So second point that I always say that एक तो प्यार टॉक्सिक है और दूसरा दर्द भी देगा. दर्द मतलब कौन सा? Gout वाला. It will be giving you a pain of gout as well. There are other properties also which I used to mention in the class with the story of pyar, that pyar preferred inside. So this is the one that is intracellularly effective drug. Avoid pyar during pregnancy. So this is also avoided during pregnancy. Okay, so these are the points that has been discussed in the class also, and quickly we have revised here as well. Apart from that, what are the other drug that has been asked here? That streptomycin. Okay, so streptomycin is one of the aminoglycoside, guys. What are the side effects associated with the streptomycin that you know? Streptomycin, aminoglycoside. I'm pretty sure you guys are aware about that. That streptomycin will be causing ototoxicity. It is going to cause ototoxicity. It is also going to cause your nephrotoxicity, and it also causes your NM blockade. So ये side effect जो है NM blockade. And I used to say all the aminoglycoside, they cause the side effect that is none. N-O-N-E. None stands for your neuromuscular blockade, nephrotoxicity, ototoxicity, N-O, ototoxicity, and neuromuscular blockade, nephrotoxicity, and E for emesis. That is nausea and vomiting. So these are the common side effects that is associated with aminoglycoside. Any of the aminoglycoside can have these side effects. Okay, N-O-N-E, nephrotoxicity, ototoxicity, NM blockade, and E for emesis. So important side effects have been summarized as had been asked in other options here. Okay, let's check the next one. So this is going to be a long session. So be ready for, I think it may cross 1 hour, it may reach to 2 hours as well, depending on your requirement. If we want to extend it, we can extend it, because the question that we have taken is from ultra important, I mean the high yield question we have taken here. Okay, next one. Which of the following antiretroviral drug causes palm and sole pigmentation? Go ahead, please. That is why it should be avoided in myasthenia gravis. Excellent, Dr. Anjana. Excellent, excellent. It should be avoided with myasthenia gravis. There is no doubt about it. Okay, go ahead please with the second question. Which of the following antiretroviral drug it is going to cause palm and sole pigmentation? You have to be very, very careful in question like this. There is something called zidovudine, nevirapine, emtricitabine, lamivudine. Please go ahead, all of you. The responses have already started to come. Other students also please try. Okay, great. Other students also please try. Okay. Now a similar kind of question I saw, it was also asked in the recent INICD which was conducted yesterday. Okay. Please check the voice. I don't know what's... Is there any problem with the audio? Any problem with the audio that you guys are facing? Hi everyone. All fine. Okay. Great. Now the question that was asked, and most of the students have even marked zidovudine. See, zidovudine undoubtedly associated with the pigmentation, but the type of pigmentation that it is going to do will be a nail pigmentation. Question क्या पूछा है? Palm and sole pigmentation. Nail pigmentation. Nevirapine is from one of the class of drug that is known as NNRTI, and all the non-nucleoside reverse transcriptase inhibitor, these are associated with the NNRTI that we have. They are associated with the rash. अब यहाँ पे भी एक problem है. They cause rash. All of them will be causing rash. All NNRTI will be causing rash. Nevirapine specifically that we have, nevirapine is spare palm and sole. It is spare palm and sole. ये बहुत ही characteristic lesion है. Right? Lamivudine does not cause this palm and sole pigmentation like side effect. The correct answer that we have is emtricitabine. Zidovudine is one of the NNRTI. It is maximally associated with your bone marrow suppression. All the nucleoside reverse transcriptase inhibitor can cause bone marrow suppression. Least will be undoubtedly your lamivudine. This is considered the safest NRTI, safest nucleoside reverse transcriptase inhibitor. But maximum bone marrow suppression is your zidovudine. So zidovudine pigmentation तो कर रहा है, but it is not causing pigmentation of palm and sole. It is causing pigmentation of nail. So difference है ना, nail pigmentation and palm and sole pigmentation में. So I hope all of you guys have got. Emtricitabine is the correct answer. How many of you have got? I think that was a laptop का noise है. I cannot do anything about it, but we'll try to see in upcoming class. We'll try to work on it. कुछ vibration का जो noise है ना, that is possibly laptop का noise. And if I do anything, the whole session might go disturbed. So try to adjust with this noise that we have. Sorry about that. Okay, chalo. Let's go with the next one. So in HIV, two types of question. I request all of you guys, please know how to identify a NRTI, nucleoside reverse transcriptase inhibitor. I have given you a story that there is someone by the name of Ziddi Dadi, है ना, Abbu, अम्मी, लव्स सिस्टर. ये स्टोरी मैंने क्लास में आपको दिया होगा, राइट? जिद्दी दादू, अब है ना, जिद्दी दादी, अब्बू, अम्मी, लव सिस्टर. दैट इज गोइंग टू बी जीरोवुडीन, डाइडेनोसिन, एबाकावीर, एम्ट्राइसिटाबीन, लैमिवुडीन. जल्दी से रिवाइज कर लीजिए. लैमिवुडीन एंड स्टैवुडीन. So you should know how to identify NRTI. Not only that, you should also know how to identify NNRTI, non-nucleoside reverse transcriptase inhibitor. A simple trick I'll be telling you. All the non-NNRTI that we have, NNRTI, non-nucleoside, उनके नाम के बीच में their name will have VIR virus in their name. VIR virus, right? Efavirenz, nevirapine, right? Delaverdine, they are all NNRTI. Okay. Lamivudine is NRTI, zidovudine is also NRTI, emtricitabine is also an NRTI. So you should know the name of the class, their important side effect, right? In HIV minimum इतना आपको जानना है. NRTI maximally associated with side effect like your hepatotoxicity, rash, ये सबसे कॉमन है, हेपेटोटॉक्सिटी, रैश है ना, ड्रग इंटरेक्शन इज ऑल्सो कॉमन विद द NNRTI. ठीक है. Side effect like the NRTI that we have, nucleoside reverse transcriptase inhibitor. Let me quickly summarize. I'll take this opportunity to tell you that they will be causing side effect like bone marrow suppression, that is maximally associated with your zidovudine. It can even cause pancreatitis, which is maximally associated with diadenosine. Okay. Peripheral neuropathy, hepatic steatosis. This will be maximally associated with drugs like your stavudine. And whatever side effect that I have told you, this is going to be least associated with your lamivudine. So we say lamivudine as a safest NRTI. Lamivudine happens to be a safest nucleoside reverse transcriptase inhibitors. Okay. So basic information you should know about these NRTI and NRTI. ठीक है. Antiviral से expect करिए question in upcoming examination, especially identifying their class and how to remember the side effect and post-exposure prophylaxis also. Okay, we have question on that as well. Next one. A 55-year-old patient is presented with decreased vision and visual field defect and was diagnosed with open-angle glaucoma. Which of the following drug act on the trabecular meshwork and affect the aqueous outflow? If you guys have been listening to me in the past, you will never make mistake in a question like this. Go ahead, please. Write the answer of this question. 55-year-old. For the treatment of glaucoma, you have started a drug acting on the trabecular meshwork and it is going to affect the outflow. Hypersensitivity reaction usually present with the rash. Abacavir के साथ एक और चीज है, since you are mentioning to Dr. Anjana, it also increase the risk of MI. Abacavir के साथ MI का risk भी देखा गया. Positive Eyes is asking, can you share the PDF? Oh yes, doctor, I will be. Other students also please take part. Take part in this one. I'll be waiting for around 30 to 40 seconds only, and then I'll proceed with the explanation. And please take part. The more you take part, the better kind of outcome you can get, because I will be able to understand that what's your platform right now. If you know this, definitely we can add on, and if you will make mistake, I'll tell you that how to avoid such mistakes. Okay, great. All of you are marking B. Now there are some students also marking A. There are students often with the C as well. Okay, first and foremost, I'll be telling you a simple trick to remember the anti-glaucoma drug, and there was a question on glaucoma also in my in our yesterday's INICT examination as well. See, in the open-angle glaucoma management, we need to give two aim of the therapy. Aim number 1, decrease the aqueous production, and other one is increase the aqueous outflow. I will talk about their side effect and all, that is different thing, but basic grossly what you need to remember whenever anyone is going to ask about glaucoma, you should know about these data that I am telling you. Decreasing the aqueous production would be drugs like your A, B, C, D and E. It is as simple as A, B, C, D, E, that stand for your alpha 2 agonist, that is your apraclonidine, and we also have brimonidine, brimonidine, that is your alpha 2 agonist. B for your beta blockers. Okay? Beta blocker, the one that we are going to prefer will be your timolol. ये बार बार क्वेश्चन आता है. But if there is a patient coming with a history of bronchial asthma, then we can use bitaxolol because it's a cardioselective one. So in bronchial asthma patients, right, especially in a country like India, this will be the drug of choice. Beta blocker is considered the drug of choice. Okay. Next that we have is C, that is going to be carbonic anhydrase inhibitor. So question ये पूछा carbonic anhydrase inhibitor which is given topically. कल के INICT में आया था, ठीक है. So INICT is relatively much easier, I believe. I mean in upcoming days. In past वाला भी मैंने देखा, कल वाला भी देखा. Papers were really okay, kind of not very difficult. Student did not have to struggle much. Carbonic anhydrase inhibitor, we can use a topical one, that is dorzolamide. and we have others as well. Dorzolamide is mainly a mild kind of carbonic anhydrase inhibitor, and this is going to be preferred mainly in the pediatric population. Okay, D for dipivefrin and E for epinephrine. So see, dipivefrin is actually a pro-drug of epinephrine only. Dipivefrin is a pro-drug of epinephrine, so sometimes it is given in the question dipivefrin as well. So please don't make mistake. A, B, C, D, E. In सबके side effect we'll be talking about, but as of now, decreasing production A, B, C, D, E, alpha 2 agonist, beta blocker, carbonic anhydrase, dipivefrin and epinephrine. Okay, moving forward, one more information that I would like to add on here, that this one, it is having dual action. What is the meaning of dual action? That it can actually decrease the production, okay, agreed, plus it is also going to increase the aqueous का outflow. It is also going to increase the aqueous का outflow. So दो action हो गए. Aqueous outflow, that is we have, remember traditionally if we talk about, in you and me, we are sitting in this classroom, majority of our aqueous outflow is happening via trabecular meshwork. But the problem in open angle glaucoma is that trabecular meshwork in majority of the patients are blocked. So we have an alternative. Like let's say the number, if you talk about the number, 70% of the aqueous outflow in a normal person is by the trabecular and 30% is by the uveoscleral. Okay? But since 70% wala is blocked already, we will be using the alternative modality. But we have drugs that can act on both actually. So let me quickly give a summary of that as well. Two kinds of drug. One is the one that can increase the trabecular meshwork, trabecular outflow, and the one that can increase the uveoscleral outflow. So uveoscleral is the alternative one. In a normal person, it is responsible for only 30% of the aqueous drainage. 30% of the aqueous drainage के लिए uveoscleral is responsible. Okay. But in treatment, we'll try to increase it more. Okay. Trabecular outflow, the drugs that we have is P. Uveoscleral outflow, the drug that we have is A. How simple is it? Right? P stands for your pilocarpine. Okay, I think you are reaching to your answers already. Right? We have epinephrine. Now other students, those who have marked other option apart from pilocarpine, should think about it. Okay. Then uveoscleral outflow will be PGF2 alpha. PGF2 alpha, uveoscleral outflow, and here we have A for alpha 2 agonist. So alpha 2 agonist that we have like apraclonidine, brimonidine, it also has some degree of dual action. So it also increases the uveoscleral outflow. There are studies that are showing yes, it also increases the uveoscleral outflow, but mainly it is a drug that decreases the aqueous production. Okay, PGF2 alpha. ये एक इसको सही कर दे रहा हूँ मैं. PGF2 alpha. So what are the PGF2 alpha analog? The drugs under PGF2 alpha analog that we have are drugs like your latanoprost, very potent drug, bimatoprost, latanoprost, bimatoprost, travoprost, tafluprost, right? These are the one. And overall, these are the most powerful drug. They are the drug of choice in a patient with the open angle glaucoma. Drug of choice, most powerful drug, most potent anti-glaucoma drug will be this one, right? And if the question is going to be asked, एक बार फिर से quickly revise कर लेते हैं. I told you that for the glaucoma, these are the drugs that we have, nothing more. ठीक है, but definitely इनके बारे में you have to know, and we have been discussing this from quite a long time. So A, B, C, D, E, alpha 2 agonist, beta blocker, carbonic anhydrase, DP and FUFE. Then aqueous outflow, trabecular, right? So trabecular के लिए pilocarpine, epinephrine, it is going to increase the trabecular outflow. Pilocarpine, epinephrine, trabecular outflow. Okay? They are the M3 agonists. Definitely they will be causing meiosis and increasing the uveoscleral outflow. So that will be your PGF2 alpha analog. PGF2 alpha analog, that is latanoprost. Okay? Latanoprost. Then we also have alpha 2 agonist, that is going to increase the uveoscleral outflow. Okay? PET, love, latanoprost, and A for alpha 2 agonist, UV, love से याद कर लीजिए, UV, uveoscleral outflow. ठीक? So you will never make a mistake if they are going to ask you question on this concept that I have asked here in the previous question. Okay, so let's see this one once again. Which of the following drug act on the trabecular meshwork and affect the aqueous outflow? So you know timolol, it's a beta blocker, right? Beta blocker, it decreases the aqueous production. it decreases the aqueous production. Okay, ruled out already. Pilocarpine is the correct answer that we have. They are the M3 agonist. Next that we have is brimonidine, alpha 2 agonist. If they are going to increase the outflow, again it will be uveoscalar, not the trabecular outflow. Okay, and brinzolamide, again carbonic anhydrase inhibitor, it's going to decrease the aqueous production. I hope all of you guys have got this. ठीक है, चलो, great. Anjana Akula is a follower. She continuously attends the classes. That's how she knows. You have to attend the classes to know the things. Okay, next. One of the very basic question to solve for all of you guys. Which of the following is true about antagonist? Be very, very careful. Antagonist. It has no intrinsic activity and no affinity for the receptor. It has a high intrinsic activity and high affinity for the receptor. It has submaximal intrinsic activity and submaximal affinity. It has no intrinsic activity and high affinity. Simple question, but थोड़ा सा confusing है. Go ahead, please. All of you, please try. About antagonist. The answers are received so far is B. Other students also please take part. D. There are B. Hard work will make anything. A. Okay, okay, great, great. Other students also please take part. D. Okay. B. Okay, so the population is divided with multiple opinion that we have here. Now, first and foremost, always remember guys, all 4 types of drug that we have. What are the different types of drug that we have discussed? On the basis of their intrinsic activity, we have discussed different types of drug. One is known as your agonist. Other one is a partial agonist. Then we have antagonist. And other one is the inverse agonist. Do you know one thing that is common among all of them? That all of them are having high affinity for the receptor. They all have high affinity for the receptor, but a different intrinsic activity. High affinity plus different intrinsic activity. For example, if the examiner asks, okay, what is the difference in the intrinsic activity? Agonist will have 100%. It has an intrinsic activity score that has been given as a +1. Partial agonist has been given a score anywhere from 0 to 1. Antagonist has been given a score of 0. And inverse agonist has an inverse score of -1. In fact, in the recent examination, one of the recent examination, they have given this question, and after giving this one, this graph was given, and they asked that which of the following drug could have possibly caused this, right? So this is your +1, 100% response. This is -1, and the graph was something like this. So this was the one drug. This is the other one, right? And we have this one, and this is going to be the 0. This is the 0.0. So the first one that we have, it is going to be agonist. This will be your partial agonist, somewhere between 0 to 1, and 0 will be antagonist. 0 is going to be antagonist. It has no intrinsic activity, but it has high affinity. It will occupy the site. It will not produce any action, but it will occupy the site. Okay? And this is going to be -1 is going to be your inverse agonist. -1 will be your inverse agonist. Okay? We have many drugs like I can say drugs like tiprolizan, pitolisant, that is the inverse agonist for H3 receptor. Beta carbolin is the inverse agonist for benzodiazepine receptors. Okay? So these are also important points that you should remember. Very good, Dr. Anjana. Okay? Beta carbolin is the inverse agonist. Okay? Tiprolizan inverse agonist का अगर example चाहिए, so we have beta carbolin that happens to be inverse agonist for benzodiazepine receptor at benzodiazepine receptor. Tiprolizan, pitolisant, these are the inverse agonists as the H3. H3 का inverse agonist होता है. ठीक है? So do remember these important areas, whatever we have discussed. Now, since they have already asked the image-based question on the basis of the image that I have drawn here in the past, there might be similar kind of questions in your examination as well. It has no intrinsic activity, yes, but they have high affinity. If you read other option, like let's say option A, if you are going to read, it has no intrinsic activity, that's correct, but no affinity, no. Affinity सभी के साथ high है. एफिनिटी सभी के साथ हाई है, ठीक है. It has high intrinsic activity, no, it does not have high intrinsic activity. Sub-maximal intrinsic activity and sub-maximal affinity, no, right? So C is also wrong. The most appropriate answer is going to be D. Okay. Moving on to the next one. Okay. Angiotensin receptor blocker which is preferred in patient with history of gout. Now this type of question we have discussed in past as well, and a similar kind of question was asked in the yesterday's exam as well. Okay? So it's not like this question I made it today or yesterday. This has been made like from like past 5-6 days already, right? So because your session has been scheduled like 4-5 days ago. So but luckily I saw that this was one question, similar kind of question in yesterday's INICT examination as well. Okay, go ahead please. Angiotensin receptor blocker which is preferred in patient with a history of gout. कौन सा प्रिफर्ड होगा? लो सार्टान, कैंडी सार्टान, टेलमी सार्टान, वल सार्टान. वेरी गुड डॉक्टर अंजना. एक्सीलेंट, एक्सीलेंट. So as all of you guys are answering it already, let me just give a quick overview of this one. Low sartan के बारे में I have told you few important information which I want you to remember now and forever. Low sartan, it has a word low in it and it lowers down everything. What is the meaning of that? It is having the lowest T half-life among all the ARB. They are lasting for around 3 to 4 hours. Lowest T half-life. Low sartan as a drug, it also lowers the uric acid level. It lowers the uric acid level because of its uricosuric property. Uricosuric property की वजह से they lower the uric acid level. Low sartan, it also lowers the thromboxane A2 property, or I would say it will lowers the platelet aggregation. It lowers the platelet aggregation, and this lowering in the platelet aggregation is because of the thromboxane A2 inhibiting property. This is not the end. This also lowers the glucose. Do you know why? Because it is having additional PPAR gamma agonistic property. Now earlier there was a question that was asked in AIMS, which is ARB having PPAR gamma agonistic property. So we used to read PPAR, peroxisome proliferator activated receptor gamma, PPAR gamma agonistic property. We used to read earlier one drug that is telmisartan, but recent studies are saying that many others have been added. Important one that I would like to tell you will be telmisartan, irbesartan, and other one will be your losartan. ये इसी order में जाता है, TIL. It goes in the same order, TIL, right? So PPAR gamma that we have, it actually increases the insulin sensitivity. They act via nuclear receptor, and via nuclear receptor they will be causing transcription of certain genes that increases the sensitivity, right? So losartan, it lowers down everything. इससे आसान क्या होगा, right? Losartan lowers the everything, right? Now candy sartan के बारे में one MCQ. Candy sartan is one such angiotensin receptor blocker, boys and girls, that is having the maximum affinity for AT1. तो अगर आपके सामने मैं कैंडी रखूं, सब लोग चाहोगे, all of you would like to grab a candy, all of you will have maximum affinity for candy. Plus कैंडी खाने से सर दर्द भी दूर होगा. Just a way to remember, it is also one of the approved drug for the prophylaxis of migraine, right? So about telmisartan I have told you already, it is having additional PPAR gamma agonistic property. This has been asked twice, thrice already. ठीक है, because of PPAR gamma agonistic property which is acting via a nuclear receptor, there will be increase in the insulin sensitivity. ठीक है, so इतनी सी बात थी इसमें. Okay, moving on to the next one. Valproate exposure to a pregnant mother causes all of the following teratogenic baby except all of the following effect except teratogenic effect का. If you have been attending any of my lectures, especially in the general pharma first day first lecture में, I used to give you a list of teratogen. ठीक है, whenever we discuss the different schedules and category, and luckily from the past few examinations we are getting questions from that. In yesterday's INICT also we got quite a number of questions on the teratogenic effect of drugs. First of all, you give this one. We'll see, Dr. Drinkle, if we can hold some more session like this. Let's first do this one. अभी तो ये करेंगे, इंपॉर्टेंट पॉइंट जो है मैं हाईलाइट कर रहा हूँ. Valproate exposure to a pregnant mother causes all of the following teratogenic effect in a baby except PCOD, neural tube defect, spina bifida, and the CVS anomalies. I think all of you guys have got the point here. That see, PCOD, can it be seen with Valproate? Of course it can be seen. But is it a teratogenic effect? Oh no, it is not. Right? Correct answer that we have is PCOD. PCOD is undoubtedly considered as a gender specific side effect that is associated, जेंडर स्पेसिफिक साइड इफेक्ट ऑफ वैल्प्रोएट. इट इज एसोसिएटेड वैल्प्रोएट. तो कोई भी फीमेल को अगर आप देते हैं राइट, इन दैट फीमेल इट इज पॉसिबल, बट इट्स नॉट अ टेराटोजेनिक इफेक्ट. व्हाट इज टेराटोजेनिक इफेक्ट? द ड्रग हैज बीन एक्सपोज टू द प्रेग्नेंट फीमेल एंड द बेबी इज डेवलपिंग सम प्रॉब्लम. ठीक है. इज इट एसोसिएटेड विद स्पाइना बाइफिडा? इट्स वन ऑफ द न्यूरो ट्यूब डिफेक्ट. यस, इट हैज ऑल्सो बीन एसोसिएटेड विद सीवीएस एनोमली, लाइक वेंट्रिकुलर सेप्टल डिफेक्ट हैज ऑल्सो बीन एसोसिएटेड. ठीक है. हाँ, एक्सेसिव वेट गेन, इंसुलिन रेजिस्टेंस वो हो जाता है. ठीक है. फैट स्पेयरिंग प्रॉपर्टी, फैट को स्पेयर करता है. ठीक है. इसलिए वेट गेन भी होता है. तो बाकी मेल्स में क्या होगा? वेट गेन होगा. बट फीमेल में पीसीओडी भी हो सकता है. इसीलिए इसका एक क्वेश्चन जो है वो पास्ट में, दैट इज विच ऑफ द फॉलोइंग द जेंडर स्पेसिफिक साइड इफेक्ट. सो दैट इज पीसीओडी. Now let me take this, I'll take this opportunity to quickly give you the list of the important teratogenic drug that we have. Of course, so this is one of the category extra. ठीक है. So these are the important drugs. The list has been given already. So valproate, it is associated with your spina bifida. Spina bifida is one of the teratogenic effect. It's an example of neural tube defect. Phenytoin also, it is associated with your fetal Hayden-Toyne syndrome. Phenytoin associated with a side effect known as your fetal Hayden-Toyne syndrome. Now sometimes they do not use the term Hayden-Toyne syndrome, fetal Hayden-Toyne syndrome. They give you the overall description, and in the description they give you that a baby is born and these are the following feature, which of the following drug would be possibly responsible behind this. So in the fetal Hayden-Toyne, phenytoin, everything becomes small. What is the meaning of everything? That is microcephaly. Okay, agreed. What else? There is thin upper lip. Okay, agreed. What else? Thin upper lip. There will be cleft lip and palate. Cleft lip and palate. There is also going to be, है ना, short phalanges. उंगलियां भी छोटी होंगी, right? Short phalanges. So these are the important feature of the fetal Hayden-Toyne syndrome. Moving on, carbamazepine, it can also lead to your neural tube defect. ठीक है. What is the lithium? What kind of teratogenic effect will lithium cause? Epstein anomaly. So आपके एग्जाम में ये पूछा हुआ है, Epstein anomaly is associated with which of the following? And then they have also asked what is the characteristic X-ray appearance. So I used to tell you that we have Epstein में we are getting a tin, and using tin we always make a box, right? So we'll be getting a typical appearance on the chest X-ray that is known as your box shaped heart. Thalidomide, I think we all know the thalidomide disaster. What kind of teratogenic effect thalidomide causes, guys? Thalidomide, absence of the long limb bone, that is your phocomelia. So there is absence of long limb bones. There is impaired generation or malformation of the long limb bones like humerus, radius, ulna, femur, tibia, fibula, all of them. ठीक है. Warfarin causes a side effect known as Contradi syndrome. Another name of Contradi syndrome is fetal warfarin syndrome, where the patient will be having skeletal and facial defect. Skeletal, cartilaginous and facial defect. So facial defect में nasal septal cartilage का भी involvement हो सकता है. Methimazole, it causes what kind of teratogenic effect, guys? Methimazole, carbimazole, it causes aplasia cutis. Causes what? Aplasia cutis. Scalp defect होता है. So in AIMS they have asked this question. 2020 में directly image ही दिखा दिया, and they asked which of the following drug could have caused. Okay. Methotrexate, again it can cause multiple side effects like neural tube defect, right? Is one of the important side effects associated with the methotrexate. Erythromycin, it will be associated with teratogenic effect like congenital hypertrophic obstructive pyloric stenosis. Congenital hypertrophic obstructive pyloric stenosis. So they will not ask directly. They might not ask directly. They might give a baby was born with a presentation of olive-shaped lump that is felt in the epigastric region. Olive-shaped lump. So जहाँ भी word आप सुने olive-shaped lump, है ना, due to congenital hypertrophic obstructive pyloric stenosis, you might get olive-shaped lump in the epigastric region. So that will be a case of CHOPS, congenital hypertrophic obstructive pyloric stenosis. Drugs associated with this will be erythromycin. Cotrimoxazole, it is associated with kernicterus. That is why again these drugs should be avoided, right? So kernicterus is one of the side effects. And remember, sometimes excessive bilirubin is also seen in the brain, and if it is there in the brain, definitely is there in the body as well. So it will also be causing a syndrome known as your yellow baby syndrome. ग्रे बेबी सिंड्रोम कल के एग्जाम में आया था, है ना? ग्रे बेबी सिंड्रोम कौन सा ड्रग करता है? क्लोरमफेनिकोल विल बी कॉजिंग ग्रे बेबी सिंड्रोम. आई जस्ट राइट इट हियर, क्लोरमफेनिकोल. सो वी ऑल नो अबाउट क्लोरमफेनिकोल, ठीक है? ये एक्सेसिव बोन मैरो सप्रेशन करता है बिकॉज ऑफ दैट ग्रे बेबी सिंड्रोम. And if any one of you have been following the INI-CD, you must have seen this question in the studies examination. Aminoglycoside, again, it can cause the same side effect as it can cause in the adults. So they also produce teratogenic effect like ototoxicity, and they also can produce nephrotoxicity. So they should also be contraindicated throughout the pregnancy. Fluoroquinolone, again, cartilaginous defect, right? Cartilaginous defect, tendinitis, arthropathy. So this side effect, tendinitis, arthropathy that we have, they can be seen in adults as well, and as a teratogenic effect as well. It can be tetracycline, teeth staining and bone growth abnormality. Teeth staining and bone growth abnormality. I'm talking about tetracycline, teeth staining and bone growth abnormality. If there is the exposure of NSAIDs, right, especially in the third trimester of pregnancy, so this has been also a question. It will be causing premature closure of ductus arteriosus. It will be causing premature closure of ductus arteriosus, right? If there is NSAID exposure. ACE inhibitors, ARV, renal tubular dysgenesis, and it will also cause fetal growth retardation. It can even cause fetal growth retardation. So we do not give any of the diuretics or RAS system inhibitor. Danazole, masculization of the female fetus. Misoprostol causes Mobius syndrome. Misoprostol causes Mobius syndrome, where there is involvement of cranial nerve 6 and 7. Involvement of cranial nerve 6 and 7 in the Mobius syndrome. Mobius syndrome can also be associated with drugs like thalidomide, but more common associated with the misoprostol, a PGE1 analog. Okay. Then if there is one more drug that we know, diethylstilbestrol. यहाँ पे मैं लिख दे रहा हूँ diethylstilbestrol. It can increase the risk of vaginal cancer in the offspring. Risk of clear cell vaginal cancer, CC, clear cell vaginal cancer in the female fetus. Okay. That is diethylstilbestrol. It can cause problem in the male as well. Okay. A female में clear cell vaginal cancer करेगा, and this was also in yesterday's examination. Okay, so quickly we have seen around 12 to 14 important teratogenic effect. This has been asked in the past. There are high possibility it can be there in upcoming examination as well. Moving on to the next one. You started a patient on oral warfarin. Which of the following factors show the most rapid decline in the blood level after the initiation of the warfarin therapy? Go ahead, please. Factor 2, protein C. Factor 10, prothrombin. You have to be careful, otherwise you will make mistake. If you do not stay careful, you will make mistake. Other students also. So we are getting responses already. Sangmesh, Anjana, both of you in favor of B. Other students also please take part. Anjana, we have two Anjana. Anjana Akula, Anjana Avasthi, C. Okay, other students are in favor of, okay. So all of you going ahead with option B. Okay, great. Other students also please take part. Now question number 1 that has been asked in warfarin. What is warfarin? It is one of the competitive inhibitors. So जो ये word में competitive लिख रहा हूँ ना, इस पे भी question आया हुआ है. Whether competitive, uncompetitive, non-competitive, it's a competitive inhibitor of the vitamin K dependent factor. See, I am not writing clotting factor. I am telling vitamin K dependent factors, because vitamin K dependent factor we have बिल्कुल. ठीक है. So let us see quickly here. I'll take this space here. So we have vitamin K dependent factor, and vitamin K causes formation of certain clotting factor, that is your 2, 7, 9 and 10, and it also causes formation of anti-clotting factor, that will be your protein C and protein S. Protein C and protein S. So to maintain the balance, protein C and protein S will be acting as an anticoagulant factor, because if there is any unopposed action of clotting factor, there will be hypercoagulation state. Now first and foremost you should know the first factor to get decreased will be factor 7. Factor 7, it is the first factor to decrease. It is the first factor to decrease that will be gone in around 6 to 7 hours. Actually मैं टेक्स्ट बुक में दिया हुआ है 6 hours, but मैं जानबूझ के 6 to 7 लिख रहा हूँ, so that you can remember 7 will be gone in around 7 hours. Next one to get reduced in around 8 hours. This is going to be the second factor to get reduced. Second factor to get affected with the warfarin. Okay. Now if you're going to talk about the other factor like factor 2 that we have, it is the last factor to decrease that will be taking around 4 to 5 days. Somewhere between that the other will be coming, 9 and 10 will be coming, but the last factor to decrease will be 4 to 5 days. So complete action of warfarin will be coming in around 4 to 5 days. So you can easily understand, if in 8 hours our anticoagulant factor is gone, there is no one to oppose clotting factors. After 8 hours there is no one to oppose an unopposed action of clotting factor like factor 2. What will happen? There will be a hypercoagulable state. What is this? We are giving anticoagulant drug, and anticoagulant drug is causing hypercoagulable state. How strange is that? See, this because of this reason only, initially with warfarin we develop something called your paradoxical hypercoagulable state. आप anticoagulant से you are getting paradoxical hypercoagulable state. This paradoxical hypercoagulable state, guys, it causes your warfarin induced skin necrosis. Warfarin induced skin necrosis, and this is not the end. It also causes, the other name for same is your purple toe syndrome, as rightly mentioned by all of you. Purple toe syndrome. Now देखिएगा, कभी भी एंटीकोआगुलेंट्स दो हैं मेनली हमारे पास, हेपेरिन एंड वारफरिन. वी हैव टू एंटीकोआगुलेंट्स, वन इज हेपेरिन, वन इज वारफरिन. If there is any problem that is occurring like hypercoagulable state, or if there is any rashes, petechial rashes, if you are going to get problem like this, within 5 days, W for warfarin, within 5 days, W for within 5 days, it will be warfarin. But if it is occurring after 5 days, after 6 days, that can be a case of heparin, because heparin also causes a problem like HIT syndrome, heparin induced thrombocytopenia. तो अगर कोई ऐसी प्रॉब्लम आती है, कोagulable state आती है, after giving anticoagulant, W for warfarin within 5 days, it will be this. And this was one of the question that was asked in 2021. Many students got confused. They said, sir, heparin भी तो हो सकता है. History था, patient was started on anticoagulant drug. After 2 days, the patient has the problem. So you already know the answer. If it is occurring within 5 days, guys, it will be warfarin, none other than warfarin, right? So the question to this, the question that is asking here, that the first factor, so first factor is factor 7, it's not in the option. So what we are left with is, we are left with the protein C and F, protein C and S, anti-clotting factor. So that is going to be our answer here, protein C, right? Factor 2, prothrombin, देखिए simple, those are just same choices. Factor 10, again, it's not the first factor to get decrease. Okay, so I hope all of you guys have got this already, this question, and that is why if you want to avoid this paradoxical hypercoagulation, see, we have to give warfarin. Warfarin definitely are more potent anticoagulant compared to heparin. We have to give. So to avoid this problem, we are supposed to add heparin with the initial days, right? Add heparin in the initial days with the heparin, initial days with the warfarin, will be adding heparin, and slowly after 5 to 6 days you can withdraw the heparin and continue the warfarin. Getting my point? So ये सारी बातें आपको याद रखनी है, ठीक है? Next, which of the following prokinetic drug has been implicated in causing serious ventricular arrhythmia, particularly in patients concurrently receiving erythromycin or ketoconazole? Very simple question, and you'll be surprised to know that a similar kind of question was asked in the recent USMLE examination. Very similar kind of question first step में, तो इसी के जैसा एक केस बेस आया हुआ है, ठीक है? तो बताइए, which of the following will be causing arrhythmia? I'll give you a hint. These drugs are not used nowadays. Dr. Anjana, that is absolutely correct. We will be doing the bridging therapy, yes, to avoid that purple toe syndrome or hypercoagulable state that is caused by the warfarin. Okay, so there are responses coming B and D. Other students also, सब लोग part लीजिए. All of you please take part in this. All of you please take part. All of you are marking either B or D, that is cisapride. Okay. Alright, so I think our time is up. We can go ahead with the correct answer, that is your एरिथमिया जो कॉज कर रहा है. बिल्कुल सही जवाब है ना. cisapride, that we have cisapride. Then we have one more drug in the same, that is known as your mosapride. Now cisapride, mosapride, tegaserod, guys, these agents are actually withdrawn now. They were actually 5-HT4 agonist, 5-HT4 agonist, and they were associated actually with your QT prolongation as a side effect. And this QT prolongation risk will further increase if you are going to use with erythromycin or ketoconazole. What are they? These are very, very potent enzyme inhibitors. So in your examination, instead of giving erythromycin, there can be clarithromycin. So that is the same, right? Any of the enzyme inhibitor, they can increase the risk. Now we have one more by the name of prucalopride. It's the newer one, prucalopride. Remember, don't be confused. Prucalopride is not the answer. Just trying to give you some information about this. Prucalopride that we have, it is one such 5-HT4 agonist. It does not causes the side effect that has been mentioned here. The side effect that has been mentioned, like a QT prolongation, it is usually not, right? So they are not associated with your QT prolongation. Okay? Not associated with QT prolongation, and they are a prokinetic agent. We can use them in any patient like constipation dominant irritable bowel syndrome, constipation dominant irritable bowel syndrome, opioid induced constipation. So read for the history. Again, I said what we are going to discuss in the explanation will be important. Opioid induced constipation, they can give you a case based scenario where a patient is on opioid and now develop constipation, right? So opioid induced constipation may be also this prucalopride can be used. Remember, any case of constipation we can use actually. ठीक है, diabetic gastroparesis भी also अपन को use कर सकते हैं. They are the 5-HT4 agonists, prucalopride. Metoclopramide is actually a D2 blocker. They are mainly associated with your extrapyramidal symptom because they cross the blood-brain barrier. ठीक, they associated with the extrapyramidal symptom. 3-4 times repeated question in AIMS, NEET PG, and last year it was also repeated in your examination, right? Which of the following anti-emetic drug can cause abnormal posture? या ठीक है, abnormal posture EPS. अब ये पुरानी बात हो गई, ठीक है. आप सब लोग प्रो हो चुके हैं with this kind of question already. Okay. इनहिबिट करके जाएगा, पिकॉक वाला आएगा, इनहिबिट करके जाएगा, बिल्कुल. So if some of you are wondering what is peacock wala is a simple memory to remember all the enzyme inhibitor like protease inhibitor, erythromycin, clarithromycin, amiodarone, cimetidine, omeprazole, ketoconazole, itraconazole. Wala will be valproate. So peacock wala aayega, inhibit karke jayega. Is a story actually that I used to tell in our classes to remember the enzyme inhibitor. Go ahead with the second one. You are about to start anti-epileptic drug in a patient with epilepsy. Which of them is wrong about the action of the anti-epileptics? All of you please. As I said that we can extend this session. This session was actually for 30 minutes only, but we will be extending this for some time because it's a final shot. So I want to cover some of the important areas. Go ahead please. Which is wrong? Phenytoin and carbamazepine act by inhibiting sodium channel opening. Okay. Carbamazepine is also preferred in trigeminal neuralgia. Diazepam is anti-epileptic. Lamotrigine act by blocking GABA-mediated chloride channel. All of you, please. Okay. Great. D seems to be the correct answer that has been given by most of you. Okay, great. Some of you are also marking B. Okay, so let's quickly jump on to our answer here. First and foremost, option A, phenytoin and carbamazepine act by blocking sodium channel. Yes, so these are all voltage gated sodium channel. The main, ion channel that we have that is involved in the release of the glutamate will be voltage gated sodium channel. Therefore, most of the major anti-epileptic drug that you can think of, they are all voltage gated sodium channel blocker. What is the meaning of most of the major anti-epileptic drug like valproate, drugs like your lamotrigine, drugs like your phenytoin, drugs like your carbamazepine, oxcarbazepine, topiramate, whatever major anti-epileptic drug that you can think of, they all will be voltage gated sodium channel blocker. Okay. So again, they are correct. They are not, they act by increasing sodium channel opening. Phenytoin and carbamazepine act by increasing sodium channel opening. Okay, you have to check on that. Okay, carbamazepine is also preferred in trigeminal neuralgia. So first and foremost, A को मैं hold करूँगा. B पे आते हैं. Carbamazepine is preferred in trigeminal neuralgia. In fact, in trigeminal neuralgia and glossopharyngeal neuralgia, carbamazepine is the drug of choice. So ये तो correct answer है. ये तो correct है. ठीक है. Carbamazepine is the drug of choice in trigeminal neuralgia and glossopharyngeal neuralgia. Diazepam has anti-epileptic property. Yes. Right, diazepam we are using as anti-epileptic drug as well in any acute seizure, rectal acute seizure maybe we can give by IV route, and febrile seizure maybe also rectal diazepam will be utilized. So definitely it has anti-epileptic property. So B and C में कोई doubt नहीं है. Lamotrigine act by blocking GABA mediated chloride channel. There is one option D, and option A, phenytoin and carbamazepine act by इंक्रीजिंग सोडियम चैनल ओपनिंग. मैंने यहाँ पे आपको भी क्या बताया, मैंने आपको बताया कि दे आर गोइंग टू बी सोडियम चैनल ब्लॉकर. मैंने लिख दिया पहले ही, नॉट ओपनिंग. अगर सोडियम चैनल की ओपनिंग होगी सो मोर एंड मोर रिलीज ऑफ ग्लूटामेट. सो व्हाट इज रॉन्ग हियर, सो ऑप्शन ए इज गोइंग टू बी रॉन्ग. Right, option A is going to be wrong. Lamotrigine act by blocking GABA mediated chloride channel. Now, first and foremost, if you want to have a anti-epileptic property of a drug, anti-epileptic drug that we have, जितने भी AED anti-epileptic drug, they should have major two property. Property number one, that they should be in a position to reduce the level of glutamate by decreasing their property, or receptor blocker, glutamate receptor blocker, or another property, they should be in a position to increase the GABA level. Either they increase the GABA mediated chloride channel activity, or they should inhibit the metabolism of GABA. So some way or the other GABA level should be increased. These are the basic concept, right? In this one, basic concept. Now look at option D. Lamotrigine act by blocking of GABA mediated chloride channel. Guys, if you block the GABA mediated chloride channel, how can you achieve the anti-epileptic property? So ये question जो है, इसमें दो आंसर पॉसिबल हो सकते हैं. There will be two wrong option that we have. A and D both are wrong. So let's take this as a bonus question. A and D both are wrong here, right? So we'll have two answer here. A and D both are wrong. So Dr. Prachi, you're also not wrong actually. ठीक है? So इसमें ये थोड़ा टाइपो एरर है. दो आंसर इसमें करेक्ट हो जाएंगे. ठीक है, ए एंड डी बोथ विल बी अ रॉन्ग स्टेटमेंट. आई होप ऑल ऑफ यू गाइस हैव गॉट हियर. A person is taking tricyclic antidepressant and presenting with a blurred vision, okay, dryness of mouth. This side effect is due to blockade of. So they are integrating in the pharma. Within pharma also there is integration. ठीक है, एक तो होता है different subject का integration, and within pharma as well we have integration. So they are integrating antidepressant with the general pharma. Go ahead please. Whenever we talk about tricyclic antidepressant, what are the drugs that we have? We have many drugs, like for example your imipramine, trimipramine, desipramine, all of them. Clomipramine, amitriptyline, nortriptyline, amitriptyline and nortriptyline. These are the tricyclic antidepressant. So definitely TCA has all the property. TCA has property like antihistaminic, anti-muscarinic, all the property that we have. But the question is asking, it blurred vision and dryness of mouth. See, blurred vision and dryness of mouth, definitely it will be because of Anticholinergic property. So muscarinic is the receptor that is responsible for that. M3 receptor blockade. M3 receptor blockade will be causing blurring of vision and dryness of mouth. It will also have H1 blocking property that can produce sedation. Okay. Anticholinergic property will also be causing problems like constipation, another problem that they can cause. Okay. They also have alpha 1 blocking property. Which one? TCA. They also have alpha 1 blocking property. It can cause fall in the blood pressure, and any fall in the blood pressure that we have, it can induce problems like reflex tachycardia. They also are known to cause your metabolic acidosis, and any metabolic acidosis that they are going to cause can also induce your ventricular arrhythmia. So they are pro-arrhythmogenic drug as well. And because they are causing arrhythmia due to metabolic acidosis, the problem that they are generating the metabolic acidosis, can you tell me how will you manage this kind of metabolic acidosis? How are you going to manage this acidosis हो रहा है ना? तो you'll be doing forced alkaline diuresis. ये भी क्वेश्चन है, बार बार आ रहा है. Forced alkaline diuresis using sodium bicarbonate. You can even use others like your carbonic anhydrase inhibitor, but sodium bicarbonate will be the preferred one. So correct answer for this one is A, and other information that we have discussed around this one will also be important, and sometimes they can give you even to identify TCA. Sorry. Okay. Which of the following drug is implicated in the causation of osteomalacia of the bone? This question is not for you actually. We'll go with the next one. Which of the following agent is used in osteoporosis is associated with DVT? Go ahead, please. A drug in osteoporosis that is associated with DVT. All of you, please. PTH analog, strontium granulate, denosumab, methylprednisolone. So देखिए हमने जनरल फार्मा भी किया, बीच में CVS भी किया. Then we are doing CNS as well. Sometimes we are doing endo as well. So ये सारे के सारे high yield topics हैं. All of you, please go ahead. Yes, Dr. Pushpa. Thank you very much. Please go ahead. The one that is causing DVT, और इसके वजह से देखिए बैन भी हो चुका है पैराथायरॉइड हार्मोन एनालॉग, स्ट्रोंशियम ग्रेनुलेट, डिनोसुमैब, मिथाइलप्रेडनिसोलोन. Okay, great. So we have a drug. I'm getting mixed responses here. Parathyroid analog, parathyroid hormone analog drug that we have is drugs like your teriparatide, and a new one that we have in this by the name of abaloparatide. Teriparatide, abaloparatide, these are the drugs that we have under the parathyroid hormone analog. Okay? Teriparatide, abaloparatide, and they are the only class of drug that is having anabolic effect. They are bone forming drugs, anabolic drugs. The one that we are talking about here, the one that can cause DVT, and because of that it has been banned as well, it will be strontium granulate. Do you know that drugs like strontium granulate that we have, it is having dual property. It actually stimulate the osteoblastic effect, and it also inhibit the osteoclastic effect. It was such a good drug, but because of DVT we are not using it. Denosumab is one of the drug that we know. Denosumab, it's a monoclonal antibody, OS, bone पे काम करने वाला drug. It's a fully human monoclonal antibody, denosumab, and this is one of the rank ligand inhibitor. Rank ligand inhibitor usually at the osteoblast. Do you remember rank ligand inhibitor usually at the osteoblast? ठीक. Methylprednisolone steroids, they can cause osteoporosis, but they will not be used in osteoporosis. They are not going to be used in osteoporosis. ये चीज देख लीजिएगा, important है. Which of the following drug that is used in the osteoporosis? Denosumab also used in Ewing sarcoma. Yes, doctor. Ewing sarcoma भी use कर सकते हैं, Paget's में भी use कर सकते हैं. ठीक है. What is the drug of choice for osteoporosis? ये भी बार बार पूछता है. What is the drug of choice in osteoporosis? Go ahead, please. Drug of choice. A question that is never going to get old will be osteoporosis drug of choice. All of you are already aware about this. bisphosphonate, like etidronate, risedronate, ibandronate, zolendronate, ये सारे के सारे सबके नाम में ड्रोनेट वर्ड आएगा. दे आर द ड्रग ऑफ चॉइस. ओके, बहुत सारे हैं एक्चुअली, है ना, बहुत सारे हैं. अच्छा, एक और चीज ये है कैसे काम करता है ये. अगर मैं पूछूं कि चलो बिसफॉस्फोनेट आई एग्रीड, you are telling me sir it is the drug of choice, how will this work? What is the mechanism of action of bisphosphonate? Can you tell me quickly how will this work? They are they are going to get deposited in the bone and they will be inhibiting the osteoclast. So mainly they will be uptaken by the osteoclast and they will be inhibiting the osteoclast. So in a simple term I will be telling you they are the osteoclast inhibitor. Again, these are also not bone forming drugs. They are not anabolic drugs. Anabolic drug that we have is recombinant parathyroid hormone analog. ठीक है? Okay. Which of the following has mixed alpha and beta agonistic property? एक ANS से क्वेश्चन ले लेते हैं important. Mixed alpha and beta agonistic property. Which of the following agent has mixed alpha and beta? Dobutamine, epinephrine, phenylephrine, phenoldopam. स्पेलिंग थोड़ा सा सही कर लीजिएगा यहाँ पे. दिस विल बी phenoldopam. F. phenoldopam. Definitely, supplementing drug definitely will improve the outcome, doctor. Supplementing definitely will improve the outcome. इसमें कोई डाउट नहीं है. Okay, go ahead please. Which is having the mixed property, alpha and beta दोनों का property किसके साथ होगा? Okay. See, some of you are marking dobutamine as an answer. Dobutamine in fact is the one drug that we know it is working selectively on beta 1. It's a selective beta 1 agonist. And that is why it is the drug of choice in the following condition. The drug of choice in a patient with the acute heart failure. Also the drug of choice in a patient with a cardiogenic shock. Drug of choice in a patient with acute heart failure. Drug of choice in a patient with a cardiogenic shock. Right. Drug of choice also for conducting is stress echocardiography. Stress echocardiography will be a drug of choice. Right. Which one that we are talking about? That is your dobutamine. Just a minute please, I'll be back. Okay, so which of the following is mixed? So it's not going to be dobutamine, it's a selective beta 1 agonist. It's a selective beta 1 agonist. Remember this, okay? It is also considered the drug of choice in a patient with the shock without oliguria. Shock without oliguria may be also, it's a drug of choice. Which one? I am talking about dobutamine. Now, which is having alpha and beta agonistic property? If you look at the other options that is been given here, like let's say phenoldopam, it is one of the D1 agonists. ये तो अल्फा बीटा पे काम ही नहीं किया. Phenylephrine is a drug that is a selective alpha 1 agonist. Phenylephrine is the drug of choice in a patient with a type of shock that is usually associated during anesthesia. Can you tell me the name? जहाँ पे ये ड्रग ऑफ चॉइस है. प्रथमेश इज आस्किंग व्हेन विल यू कम टू जासू. सून डॉक्टर, पॉसिबली. आई एम नॉट वेरी श्योर अबाउट द डेट. वी स्टिल टू हैव द डिस्कशन. इट विल बी अनाउंस्ड बाय योर मैनेजमेंट. यू कैन इंक्वायर फ्रॉम द ऑफिस, योर ऑफिस. गो अहेड प्लीज. Phenylephrine is the drug of choice in which scenario? I give you a hint that it is associated with anesthesia. Correct answer for this question is going to be epinephrine. It is having alpha 1 and beta 2 property both. epinephrine is going to act, the action of epinephrine that we have. ओहो, उसका नाम एनेस्थीसिया इंड्यूस थोड़ी होगा यार, इतना आसान थोड़ी पूछूंगा मैं तो खुद ही बोल रहा हूँ ड्यूरिंग एनेस्थीसिया टाइप ऑफ शॉक, आई एम आस्किंग स्पेसिफिक नेम. जैसे मान लो अगर एक्सेस वेगल टोन हो जाए तो उसको बोलते हैं वेसोवेगल शॉक ना, वेसोवेगल शॉक. सो अ टाइप ऑफ शॉक दैट आई एम टॉकिंग अबाउट. आप जब तक सोचिए जब तक मैं लिख रहा हूँ, अदरवाइज लास्ट में मैं आंसर आपको दे दूंगा. एपिनेफ्रिन दैट वी हैव, इट विल बी एक्टिंग ऑन द अल्फा 1, अल्फा 2, beta 1, beta 2, beta 3. It will be acting on every receptor. So if the examiner is asking mixed action on the alpha and beta, guys, this was a very simple, straightforward question. It was a very simple and a straightforward question. You don't need even a lot of logic in this one. However, examiner also asks you a couple of questions on the basis of epinephrine, that in which condition you can use epinephrine. Do you know what are the different uses of epinephrine? That has also been a part of question in your examination. What are the different uses of epinephrine? Can you tell me? Any one of you? Different uses of epinephrine. एपिनेफ्रिन का डिफरेंट यूजेस बताइए. एनाफाइलेक्टिक शॉक, आई थिंक ये सबको पता होगा. जैसे कि मान ली एनाफाइलेक्टिक कैन ऑकर ड्यू टू लाइक लेट्स से पेनिसिलिन यूज, तो उसका एक नाम है ना एनाफाइलेक्टिक शॉक, उसको थोड़ी बोलेंगे पेनिसिलिन इंड्यूस शॉक, वो तो उसका कॉज हो गया. बट आई एम आस्किंग हियर दैट इफ देयर इज एनाफाइलेक्टिक शॉक वी कैन यूज. So anaphylactic shock due to it can be due to many reasons. One of the reason can be let's say antibiotic usage. उसमें drug of choice है. I mean adrenaline we can use 1:1000. Intramuscular route से we'll be using 0.5 ml. So ये बार क्वेश्चन पूछता है. 0.5 ml, 1:1000. Then we can also use them in a patient with the bronchial asthma. We can also use them for the cardiac resuscitation. For the cardiac resuscitation also we can use. For the duration prolongation of LA. Duration prolongation of local anesthetic, and also for the epistaxis. Also for the epistaxis we can use. Epistaxis as a a topical we can use, locally we can apply this, and here the concentration will be 1:100,000. Yeah, 1:1 lakh. Along with the lignocaine, if you are going to use, you will be using a concentration of 1:200,000, or you can remember like 2 lakhs. 1:200,000 or 2 lakhs. Okay. Now, so these are the different uses that we have. A, B, C, D. Again, you can easily remember: anaphylactic shock, bronchial asthma, cardiac resuscitation, duration prolongation, and E for epistaxis. सबके use कर सकते हैं. Now coming back to the question that I asked you, that a shock that can be associated during anesthesia. So आप I think किसी ने जवाब नहीं दिया उसका, मैं आपको जवाब देता हूँ. दैट विल बी न्यूरोजेनिक शॉक. ठीक है. सो इन अ पेशेंट विद न्यूरोजेनिक शॉक, दिस विल बी द ड्रग ऑफ चॉइस. व्हिच वन इज द ड्रग ऑफ चॉइस गोइंग टू बी? फिनाइलेफ्रिन. फिनाइलेफ्रिन हैज मल्टीपल अदर यूजेस लाइक ऑर्थोस्टैटिक हाइपरटेंशन में भी ऑल्सो वी कैन यूटिलाइज ड्रग लाइक फिनाइलेफ्रिन. ओके. Correct answer for this question is B. So what we discussed is not the question and answer of this one, but everything that we've discussed around this question. You should revise it whenever you are revising from your notes. Okay. 34-year-old patient presented to OPD with complaints of fever with chills, rigors, peripheral blood smear revealed banana shaped gametes. So पैथो को फार्मा से इंटीग्रेट किया. बनाना शेप गैमेट किस में मिलता है? तो अगर आपने कभी मेरी क्लास लगाई तो मैं बोलता हूँ बनाना इज अ फ्रूट. फ्रूट को हिंदी में क्या बोलते हैं, एंड आपका आंसर आपके सामने आ जाएगा. ठीक है. फॉर विच ही वॉज स्टार्टेड ऑन आर्टिसोनेट, द ड्रग आर्टिसोनेट एक्ट बाई. तो आई थिंक आपको पहले डायग्नोसिस बताना है. तो यहाँ पे तो एक्चुअली पूछ नहीं रहा है कि कौन सा पैरासाइट है. इज आस्किंग व्हाट इज द ड्रग ऑफ चॉइस, व्हाट इज द ड्रग mechanism of action of artesunate. Sorry, they are asking the mechanism of action of artesunate. Go ahead please. Free radical generation, parasitic heme polymerase inhibition, gametocytic action, or cell wall inhibition. I'm not able to see your comments. Maybe there is some issue. On this platform, I am also announcing that most likely tomorrow I'll be doing the recall session of INICT. Okay, now it's on now. Please go ahead. There was some issue with my internet, I guess. All of you are marking A, free radical generation. Okay, so the diagnosis here is banana is a fruit, phal, Plasmodium falciparum. Plasmodium falciparum is the answer, diagnosis here. And of course, for this one, we will be giving artesunate or artemisinin combination therapy. Okay, so free radical generation, that is the correct answer. They will be acting by free radical generation, that is going to produce cidal effect on the malarial parasite. Parasitic heme polymerase inhibitor. So what are the drugs that are acting as a heme polymerase inhibitor? The drugs that are acting as a heme polymerase inhibitor, anyone? That will be your lumefantrine, mefloquine, right, chloroquine, quinine. So they are all heme polymerase inhibitor. और मैं आपको बोलता हूँ कि जो लॉन्ग एमसीक्यू होते हैं वो आपका खून जला देते हैं. Long MCQ, they always burn your blood. You don't like them. So heme polymerase inhibitor. In the parasitic food vacuole, there is an enzyme heme polymerase which is actually inactivating heme into hemozoin. Okay? Heme is toxic to the malarial parasite. If we inhibit heme polymerase, there will be excessive accumulation of heme and that will be toxic to the parasite. And parasite again, it will be having a cidal effect to the parasite. Gametocytic property will be noted with the drugs like your primaquine, tafenoquine, right? Primaquine, tafenoquine, right? That will be your gametocytic, right? So correct answer that we are having free. So how do I ask you to remember that? Remember the artesunate drug that we have, or any artemisinin based therapy that we have, they are derived from traditional Chinese medicine, and Chinese guys are very very free. Chinese क्या होते हैं, वो बहुत फ्री होते हैं, राइट? सो उनके फ्रीडम के वजह से हमने देखा 2 साल अभी कोविड में देखा है ना. सो जो चाइना से आता है फ्री रेडिकल वाले होते हैं, ठीक है. चाइनीज गाइस आर वेरी वेरी फ्री. जस्ट अ वे टू रिमेंबर. Desmopressin is synthetic analog of ADH. It is preferred over vasopressin in the treatment of the diabetes insipidus for all of the following reason except. Why should you prefer them? It's a more potent antidiuretic. It has selective vasopressin V1 receptor agonistic property. It has little vasoconstricting property. It is longer acting. Desmopressin is synthetic analog of ADH. It is preferred over vasopressin. Go ahead, please. For all of the following reason except. Desmopressin definitely is longer acting. It has little vasoconstrictor. बिल्कुल सही जवाब. V1 एगोनिस्टिक एक्टिविटी जो होता है ना, वो एक न्यू ड्रग हमारे पास है बाय द नेम ऑफ टर्लीप्रेसिन, है ना. टर्लीप्रेसिन दैट वी हैव, दे कैन बी यूटिलाइज इन अ पेशेंट विद द टर्लीप्रेसिन, है ना. इसोफेजियल वेरिशियल ब्लीड, इसोफेजियल वेरिशियल ब्लीड में वी कैन यूटिलाइज देम. इसोफेजियल वेरिशियल ब्लीड में वी कैन यूटिलाइज टर्लीप्रेसिन. Okay. V1 agonistic property is not noted with the desmopressin. Remember that. So that is a wrong statement. Desmopressin that we have, it is the drug of choice in a patient with the central diabetes insipidus. Drug of choice in a patient with central diabetes insipidus. Other answers are sahi, correct. 40-year-old man has been has megaloblastic anemia and early sign of neurological abnormality. Exact similar kind of question has been asked in your examination 2015-16. Okay. And many students got confused. I'll tell you where they got confused. First of all, solve the answer. There is early sign of neurological abnormality and megaloblastic anemia, both. The drug most probably required is, in fact, when you solve the FMGE solution, you will be getting this question, the question that I'm talking here. Folic acid, iron sulfate, erythropoietin, vitamin B12. We are about to finish. Please go ahead. We have extended already to more than 1 hour. All of you, please go ahead. Yes, vitamin B12. बिल्कुल सही जवाब, right? Vitamin B12, because vitamin B12 it will be causing myelination, plus also it will be utilized in the management of the megaloblastic anemia. Can we also use folic acid? Yes, but the problem is that folic acid will be taking care of the megaloblastic anemia, but it cannot take care of the neurological abnormality. So which one will be required best? If you have folic acid, vitamin B12 both, we'll be going ahead with the vitamin B12. ठीक है? ठीक है. Yes, that's what I'm telling. Dr. MBBS surgeon, it has been repeated multiple times. A 29-year-old patient was started on glycophyllin for dermatophytosis. Which of the following statement is false about this drug? Please go ahead. Which of the following statement is false? Can cause lupus-like syndrome. It's a potent enzyme inducer. Act by inhibiting synthesis of the ergosterol and causes disulfiram-like reaction. The name of the drug is glycophyllin. So once again, glycophyllin is also hot topic for you. They can always ask you. With the glycophyllin, remember that with the fatty food there is increase in the absorption. Fatty food increases their absorption. Which one? That is glycophyllin. Yes, bilkul. So what is the mechanism of action of glycophyllin, guys? What is the mechanism of action? Dr. MBBS surgeon, yogi, medicine lover, Sangmesh, Prathamesh, Jadhav. What's the mechanism of action, बच्चों? क्या है? Glycophyllin. It's one of the microtubule inhibitor. Microtubule inhibitor. They are the fungistatic drug. Fungistatic तो property हो गया. Fungistatic mechanism of action नहीं होता है. Fungistatic is the property. Microtubule inhibitor is the mechanism of action and act by inhibiting synthesis of ergosterol. This will be wrong. Ergosterol synthesis inhibitor will be drugs like terbinafine, amphotericin B, ketoconazole. वो सारे के सारे. ठीक है. A patient has been treated for bipolar disorder for several months using lithium. Which of the following is a common adverse effect of the lithium carbonate? Again, lithium. CNS का टॉपिक lithium हमेशा हॉट टॉपिक रहता है आपके एग्जाम के लिए. Dry mouth, hyperthyroidism, leukopenia, nephrogenic diabetes insipidus. Dr. Sukhbir is asking, will INICT November 2023 happen or not? As far as the information, this should start from 2024. But this is not the right platform to commit or comment on anything. Just wait for any official announcement. Dr. Sukhbir Singh, go ahead please with the answer of this one. हाँ, माइक्रोट्यूबुल इनहिबिटर से माइटोसिस ही नहीं होगा ना. माइटोसिस का वो बात सेम है जो आपने बोला डॉक्टर एमबीबीएस सर्जन, इज सेम एज माइक्रोट्यूबुल इनहिबिटर. सो माइक्रोट्यूबुल्स आर इन्वॉल्व इन द दिस माइटोसिस ओनली. ठीक है. सो माइटोसिस इनहिबिटर, माइक्रोट्यूबुल इनहिबिटर, दे आर सेम थिंग. So D, most of you are telling, okay. Dryness of mouth, hyperthyroidism. They actually causes hypothyroidism actually, and they cause a leukocytosis. They cause leukocytosis. ठीक है. They cause leukocytosis. Hyperthyroidism, no, they actually causes hypothyroidism. है ना, because lithium has peripheral T4 to T3 inhibiting property. This is done by your lithium. Nephrogenic diabetes insipidus is the correct one. Another question that has been asked, what is the drug of choice for this one? That is going to be epithelial sodium channel blocker. That is going to be amiloride. Amiloride is one of the drug of choice for nephrogenic diabetes insipidus caused by lithium. DPL, which tells the efficacy and indication of drug, need not mention the following: common side effect but non-serious, rare side effect but serious, expiry date of a drug, should quote for reference of all the inference regarding the drug. Now if you guys are aware it or not, but in your recent guideline of NMC, this topic DPL, drug promotional literature, is very very important. Okay, so this is usually discussed in the practicals. Pharmacology practical में discuss करते हैं drug promotional literature. So WHO actually has given a guideline that when the MR is meeting a doctor, what all important information he or she should give important information. So there are 11-point checklist. They have given 11-point checklist, and these point checklist should be there. A doctor should also know that they have to inquire about this. ठीक है. So what all information a DPL should include? What is DPL? आप देखे होंगे ना, कोई भी MR अगर डॉक्टर के पास जाता है तो they used to have some leaflet, है ना, प्रिंटेड मटेरियल होता है उनके पास, है ना. एंड नाउ इट इज तो दे आर ऑल मॉडर्न MR, so they are coming with the iPad, है ना, उनके पास भी they'll keep on swiping left and right, up and down, and they'll be telling ये सही है, वो सही है, and this is good, that is good, and लास्ट में बोलेंगे सर ये पेन ले लो, हमारी दवाई लिख दो, है ना. सो इन सब पे कैपिंग करने के लिए, है ना, WHO ने काफ़ी सारे गाइडलाइंस बना रखे हैं. तो क्या उसमें नहीं होना चाहिए ड्रग प्रमोशनल लिटरेचर में, है ना. सी एक्सपायरी डेट ऑफ ए ड्रग. Okay, great. So most of you are marking okay, correct answer. So it should have multiple information, like for example, the active component of a drug, active compound, or I would say, let's say, generic name of a drug. It should definitely have the brand name of the drug, right? And any particular active ingredient that can actually cause the problem, active ingredient that is known to cause the problem, known to cause problem, ये उस पे होना चाहिए. In addition to this, there can be other information as well. What are those? Other information can be their dose, their dosage form, their important side effect, contraindication. ये सारे information होनी चाहिए. There should also be address of the manufacturer. जो manufacturer बना रहा है उसका भी address होना चाहिए. References should be there. Reference should be there, है ना. Important drug interaction, अगर कोई इसके साथ drug interaction है तो वो भी होना चाहिए. कितने डोज में लेना है, कितनी डोसेज, किस डोसेज फॉर्म में लेना है, ठीक है. ऑल दिस इंफॉर्मेशन शुड बी देयर. बट एक्सपायरी पीरियड ऑफ ड्रग, कम ऑन यार, ये तो बड़ा कॉमन सेंस है. एक्सपायरी पीरियड ऑफ ड्रग वो डीपीएल पे कैसे होगा, है ना. वो डीपीएल पे कैसे होगा, कॉस्ट भी होगा, चार्जेस भी होने चाहिए, ठीक है. बट एक्सपायरी पीरियड ऑफ ड्रग क्यों होगा. डीपीएल इज जस्ट टू प्रोमोट द ड्रग, है ना. एक्सपायरी पीरियड तो ड्रग के लीफलेट पे होगा. जिस ड्रग को जब मैन्युफैक्चर करेंगे उसके अकॉर्डिंग उसका एक्सपायरी पीरियड डिसाइड होगा, है ना. एक्सपायरी पीरियड डीपीएल पे नहीं होगा, ठीक है. Okay, mechanism of action of nevirapine is, I think I have given you information like this. nevirapine के नाम में एक VIR वायरस आ रहा है. क्या आ रहा है, VIR वायरस. इट्स अ फ्यूजन इनिबिटर. फ्यूजन इनिबिटर कल के INICT में भी आया था. नेम ऑफ द ड्रग इज योर एनफ्यूवर्टाइड. दैट इज वन ऑफ द ग्लाइकोप्रोटीन GP41 इनिबिटर, ठीक है. बिल्कुल डॉक्टर, ठीक है. इट्स NNRTI. तो मैंने क्या बताया था, NNRTI के नाम में VIR वायरस आएगा, नॉन न्यूक्लियोसाइड रिवर्स ट्रांसक्रिप्टेज इनहिबिटर. NRTI के मैंने एक बारे में बताया था आपको, जिद्दी दादी, अब्बू अम्मी, लव सिस्टर, राइट. जिडोवुडीन, डाइटेनोसिन, एपेकावीर, लैमिवुडीन, स्टेबुडीन, ये सारे के सारे आपके NRTI हैं. प्रोटीएज इनहिबिटर, ऑल द प्रोटीएज इनहिबिटर दे विल बी एंडिंग विथ नावीर, राइट. इंडीनावीर, रिटोनावीर, टिप्रानावीर, है ना, लोपीनावीर, सेक्विनावीर, these are all protease inhibitors. So identify the name of the drugs, very very important. Interleukin receptor antagonist, which is interleukin 2. I'll rule out, and I want all of you guys to be a little fast now because we have to finish the session already. We are already very late, right. Go ahead please. Interleukin 2, secukinumab के नाम में SE word आ रहा है. So this is one of the interleukin 17 inhibitor that is mainly utilized in a patient with a chronic plaque psoriasis. They will be utilized in a patient with a chronic plaque psoriasis. Secukinumab. Tocilizumab. Look at the name. Tocilizumab. अगर कभी भी मेरी क्लास अटेंड किया तो मैं बार बार इसको कभी टोसिलिजुमाब पढ़ता ही नहीं. मैं बोलता हूँ इसको पढ़ो टोसिक्सिलिजुमाब. क्या पढ़ना है, फिर से बोल रहा हूँ, टोसिक्सिलिजुमाब. And there is one more, sarilumab. So sarilumab and tocilizumab, they are the interleukin 6 inhibitor. Rituximab, Ritu, the young girl, right. So what was the age of the young girl, anti-CD20 monoclonal antibody, that is your Ritu, ठीक है. इंटरल्यूकिन 2 इनिबिटर, D से होता है 2, तो मैंने सारे तो रूल आउट कर दिए, तो बचा यही. सो वी हैव वन मोर, दैट इज इंटरल्यूकिन 2, दैट इज बेसिलिक्सिमैब. दीज आर द इंटरल्यूकिन 2 और anti-CD25 monoclonal एंटीबॉडी, ठीक है. D से 2 और B इज द सेकेंड लेटर. D से 2 और B इज द second letter, right. D से 2. Correct answer is D. Which of the following agent is used for the reversal of the rivaroxaban toxicity? Second last question. After this we'll have one more question and then we'll end. Okay. For reversal of the rivaroxaban, first of all you have to know which class of drug is rivaroxaban. Go ahead please, give your answer please. rivaroxaban कौन से क्लास का ड्रग है, नाम को मैंने बड़ा डिस्टिंक्टली लिख दिया. सो जो 10A पे बैन लगा दे, दैट विल बी रिवारोक्साबैन. 10A पे बैन लगाने वाले ड्रग, 10A पे बैन लगा देते हैं ये, तो 10A इनिबिटर है. एंड 10A को न्यूट्रलाइज करने वाले ड्रग, लुक एट द नेम, ये 10A को न्यूट्रलाइज कर देते हैं. एंडिक्सानेट अल्फा 10A को न्यूट्रलाइज करने वाले ड्रग. फ्रेश फ्रोजन प्लाज्मा और विटामिन K1 दैट वी हैव, this will be utilized an antidote in warfarin toxicity. So this match the following has also been asked in the previous NEET PG and INICT exam. Idarucizumab, right? Idarucizumab that we have, that is dabigatran. Idarucizumab is your dabigatran. What is dabigatran, guys? It is one of the direct thrombin antagonist, right? Direct thrombin antagonist. Idarucizumab, तो मैं बोलता हूँ क्या, दबा के दारू, right? Idarucizumab, dabigatran, दबा के दारू. Protamine sulfate that we have, PS protamine sulfate, they are the chemical antagonist for your heparin. Remember, I am telling you they are for heparin. I didn't say low molecular weight heparin, I said heparin. Another antidote that they ask frequently in your hematology will be antidote for the streptokinase, that will be your epsilon amino caproic acid. Epsilon amino caproic acid, that is the antidote for epsilon your streptokinase, that is tissue plasminogen activator. Last question for the day will be this one. ये जो sorry, ये जो मैंने आपके लिए ये वाला ड्रॉ किया, प्लीज डू रिमेंबर, दिस इज वेरी वेरी इंपॉर्टेंट. एप्सिलॉन अमाइनो कैप्रोइक एसिड, अल्टरनेटिवली वी कैन ऑल्सो यूज ट्रानेक्सामिक एसिड. सो ट्रानेक्सामिक एसिड डू वी हैव? यस, ट्रानेक्सामिक एसिड वी हैव, वी कैन यूज अल्टरनेटिवली. जैसे कि इन वारफारिन टॉक्सिटी वी विल बी प्रिफरिंग विटामिन K1 phytonadione. फ्रेश फ्रोजन प्लाज्मा विल बी यूज ओनली व्हेन इफ देयर इज इंक्रीज रिस्क ऑफ ब्लीडिंग, PTINR level is more than 20, और एनी ब्लीडिंग का सिम्टम आ रहा है, एक्टिव ब्लीडिंग अगर हो रहा है, उसके सिम्टम आ रहे हैं, देन वी कैन यूज फ्रेश फ्रोजन प्लाज्मा. प्रिफर्ड वन अगेन हियर एज वेल विटामिन K1 होगा. ठीक है, ओके. नेक्स्ट क्वेश्चन, एंटी माइक्रोबियल एजेंट विच इज हैविंग एडिशनल माओ इनहिबिटिंग प्रॉपर्टी. सी, माओ इनहिबिटिंग प्रॉपर्टी इज नोटेड विथ योर ड्रग्स लाइक योर सेलेजिलिन, रेसाजिलिन, वो सारे माओ इनहिबिटिंग होते हैं, बट एंटी माइक्रोबियल, राइट? सो वी हैव ड्रग विच इज हैविंग एंटी माइक्रोबियल प्रॉपर्टी. कैन यू गाइस give me the answer here, please? Antimicrobial agent that is having MAO inhibiting property. Which antimicrobial? Polymyxin, linezolid, streptomycin, bacitracin. Okay. Great. Linezolid, right? So this linezolid, it also increase the risk of serotonin syndrome. See, antimicrobial agent that is increasing the risk of serotonin syndrome, और इसीलिए कभी भी we never give them with the MAO inhibitors. ठीक है, वी नेवर गिव द माओ इनहिबिटर. ठीक है, सो दिस विल बी एवरीथिंग. आई थिंक एक क्वेश्चन और रह जाता है, उसको भी कर लेते हैं. वाई टू लीव दिस वन? विच आर द फॉलोइंग द रिसेंटली अप्रूव्ड ड्रग फॉर द हाइपो एक्टिव सेक्सुअल डिजायर इन फीमेल, है ना? हाइपो एक्टिव सेक्सुअल डिजायर इन फीमेल. इसमें आप लोग FMGE स्टूडेंट एक और ड्रग याद कर लीजिएगा, दैट इज लेस्मीडिटैन. लेस्मीडिटैन, दैट इज वन ऑफ द 5-HT1F एगोनिस्ट. इट इज एक्चुअली अ ड्रग दैट इज प्रिफर्ड इन अ पेशेंट विद अ माइग्रेन. तो ये एक एडिशनल इन्फॉर्मेशन मैं दे रहा हूँ, बिकॉज दिस इज क्वेश्चन फ्रॉम अटाकॉइड चैप्टर. सो लेस्मीडिटैन आपको याद रहना चाहिए. प्लस अगेन थिंग यू शुड रिमेंबर, अगेन वन थिंग, that they will not increase the risk of coronary vasospasm or vasoconstriction, like they do not increase the risk of MI like any other like dihydroergotamine or your other triptans that we have. तो इनके साथ ये प्रॉब्लम है that they do not cause vasoconstriction. वो एडवांटेज है, प्रॉब्लम नहीं है, दैट इज वन एडवांटेज. लेस्मीडिटैन. हाँ जी डॉक्टर, फॉर द माइग्रेन. अब इसका जवाब दीजिए. हाइपो एक्टिव सेक्सुअल डिजायर इन फीमेल. सो द ड्रग दैट वी हैव इज वेरी इजी. फीमेल के लिबिडो को इंक्रीज करने वाला ड्रग, फीमेल के लिबिडो को इंक्रीज करने वाला ड्रग, दैट इज गोइंग टू बी फ्लिबांसेरिन इज द करेक्ट आंसर. दैट इज वन ऑफ द 5-HT1A एगोनिस्ट एंड 5-HT2C का एंटागनिस्ट, राइट? फीमेल के लिबिडो को इंक्रीज करने वाला ड्रग, है ना? कार्टानसेरिन, डिटानसेरिन 2A 2C एंटागनिस्ट. लोर कार्सेरिन, लोड को कम करने वाले ड्रग. लोर कार्सेरिन क्या करते हैं? लोड को कम करते हैं. दीज आर द 5-HT2A एगोनिस्ट. ठीक है, 5-HT2 एगोनिस्ट लोड को कम करने वाले ड्रग हैं. सो दे आर मेनली यूटिलाइज इन ओबेसिटी. तो मैं फिर से 2-3 ड्रग का नाम बोल रहा हूँ जिसको आपको कभी नहीं भूलना है, और स्पेशली अभी एग्जाम तक तो नहीं भूलना है. एक मैंने बोला फ्लिबांसेरिन, प्लीज डोंट फॉरगेट, फीमेल के लिबिडो वाला. लेस्मीडिटैन, इसी चैप्टर से, सब एक ही चैप्टर से. लेस्मीडिटैन अगेन इन माइग्रेन वी कैन यूटिलाइज, प्लीज डोंट फॉरगेट. लोअर कार्सेरिन आपके लोड को कम कर देता है. लोअर कार्सेरिन 5-HT2 एगोनिस्ट यूज्ड इन ओबेसिटी. और एक और मैंने जो आपको बोला था, जो आपको नहीं भूलना है, दैट इज योर प्रूकैलोप्राइड. इसको भी प्लीज नहीं भूलिएगा. प्रूकैलोप्राइड इट इज ऑल्सो वन ऑफ द 5-HT4 एगोनिस्ट दैट इज यूज्ड इन द इरिटेबल bowel syndrome, which is constipation dominant. So constipation dominant irritable bowel syndrome or any other case of constipation we can utilize. So that will be all. आई थिंक एक लास्ट रह गया, प्लीज इसको कर लीजिए। एंटी फंगल एजेंट फ्लूसाइटोसिन, 5 फ्लूसाइटोसिन, सॉरी अबाउट दिस, 5 फ्लूसाइटोसिन एक्ट बाय, तो ये प्रॉमिस लास्ट क्वेश्चन होगा। 5 फ्लूसाइटोसिन एक्ट बाय सेल वॉल ऑफ द फंगस, ऑक्सीडेशन ऑफ स्क्वेलिन, डीएनए एंड आरएनए पॉलीमरेजेस, प्रोटीन सिंथेसिस। ठीक है, so all of you are giving it already the answer, that is DNA and RNA. Protein synthesis inhibitor in the antifungal drug that we have is tavaborole, not a very commonly used, yes, but definitely we have this. Oxidation of squalene is squalene epoxidase inhibitor, बोलिए directly, squalene epoxidase inhibitor that we have by the name of terbinafine, naftifine. सेल वॉल ऑफ फंगस, नाउ ये आप मुझे बता सकते हैं क्या, कौन से ऐसे एंटी फंगल ड्रग हैं जो सेल वॉल ऑफ द फंगस में यूज करते हैं। 5 फ्लूसाइटोसिन एक्चुअली इट इज मेनली यूटिलाइज इन क्रिप्टोकोकल मेनिंजाइटिस along with amphotericin B. You can add this in cryptococcal meningitis along with the amphotericin B, we can utilize them. Okay, सेल वॉल ऑफ द फंगस का नाम बताइए, एक ड्रग विच कैन इनहिबिट द सेल वॉल ऑफ द फंगस। चलिए मैं थोड़ा टाइम को सेव करूंगा। कैस्पोफंगीन, मिकाफंगीन, कैस्पोफंगीन, मिकाफंगीन, एनीड्यूलाफंगीन, दे आर द सेल वॉल इनहिबिटर, है ना, सेल वॉल ऑफ द फंगस इनहिबिटर, एंड दे आर ऑल्सो गोइंग टू हैव अ साइडल इफेक्ट, है ना। बीटा 1,3 ग्लूकैन सिंथेज इनहिबिटर, ये इनको टारगेट करता है, ठीक है। बीटा 1,3 ग्लूकैन सिंथेज को टारगेट करने वाला ड्रग है, दैट इज योर कैस्पोफंगीन, मिकाफंगीन एंड एनीड्यूलाफंगीन, दे आर द सेल वॉल इनहिबिटर्स, ठीक है। सो दिस विल बी एवरीथिंग about our today's session. I think we have covered quite good number of questions here, and I hope I was able to give you some insight here. In upcoming days we can have some more session like this. वो उसका क्लास का नाम है डॉक्टर प्रिंस, है ना, दैट इज द नेम ऑफ द क्लास, ठीक है। डेफिनेटली ऑल ऑफ यू शुड जस्ट कीप वर्किंग। जो क्लास आप बोल रहे हैं डॉक्टर, दैट इज योर इकाइनोकैंडिन, इसका क्लास का नाम है, द नेम ऑफ द क्लास इज इकाइनोकैंडिन्स, इकाइनोकैंडिन्स, ठीक है, is the name of the class. All right, thank you very much to all of you, and just keep revising, and if there's any thing that is troubling you, you can definitely reach out to us. We are just one click away from all of you, and always remember that जैसे जैसे एग्जाम नजदीक आएगा, you might feel anxiety, you might feel कि यार कुछ नहीं पढ़ा, you might feel, है ना, कि ये छूट गया, या I'm missing that, है ना। So please don't go into that. Now it's time to go, avoid any newer thing that you have. Go ahead with whatever you have read, revise with whatever you have read, and do the MCQs on the daily basis. It's time for you to at least spend more than 3 hours on the MCQs, and continue with your revision part. Revision part में ध्यान रखिएगा, जब आप MCQ solve करते हैं, if any MCQ is going wrong, go retro back again, retrograde again, जा करके आप अपने notes पे focus करिए, देखिए कि why and how did you made the mistake. Try to avoid such mistake in your examination. The most common cause of mistakes is always going to be the silly mistakes, not the other kind of mistake, but the silly mistakes are the most common cause of mistakes. So try avoiding that as well. I'll be sharing this PDF in all our social media platform that we have. You can simply search it out and you will find it out. In fact, in Unacademy का जो Telegram group है, वहाँ पे मैं इस PDF को share कर दूँगा. I hope to see you in upcoming classes, and if you guys are free, you can watch the tomorrow's INI-CET recall session as well. Thank you very much to all of you. Have a good night, and take care.